Alrighty, so residency reflection number 2. So this next week is going to be the first full week of the residency, getting in clinic, all 3 days of the clinic days, and then school the other 2 days at George Washington. So schedule is getting busier, which is good, and then within another 2 to 3 weeks, the full-on residency schedule with the mentoring sessions and everything like that. So a little anxious about how it's all going to go with ramping everything up, but also excited because I tend to have a tendency to perform better under pressure and do well in that type of scenario. So excited, but a little nervous too. Still kind of an orientation week coming up this week at the hospital. Orientation from last week was a little bit overwhelming. So this hospital has 900 beds, Washington Hospital Center, MedStar Washington Hospital Center. And any hospital I've ever been in has only had 250 beds, and that's the biggest that I've ever been in. So this is a much larger hospital. There's a lot more people involved, a lot more therapy staff, but some more medically complex patients. There's a number of ICUs at this hospital, so a little bit anxious about that. But I've been studying some of the neuroanatomy a little more and looking into a little bit more of the medical side of things. Kind of been working on making myself a cheat sheet for the arrhythmias and some of the other more medical side of things that I haven't had to deal with in the past, so I can kind of use that as a quick reference. But yeah, excited for it. We last week my co-resident Jessica Anderson and we hosted a review session for the course that we're helping teach. It was a little rough. The students were just kind of burnt out towards the end of the week. They've got a couple big weeks coming up with tests and practicals and things, but we kind of pivoted a little bit, talked about some stress management techniques. I thought we handled it well. The students seemed to respond well to that, and they all said that they got something out of the review session, so that was good. But looking forward to kind of getting fully started this week, and I guess anxious would be the biggest word, because I'm just anxious to get started, anxious to get going, anxious to see what it's all going to actually entail, see how I handle it, and anxious to just keep moving forward. So not too much to report on. Last week was kind of a weird week with orientation at the hospital and the review, so there wasn't like typical class, so that was kind of different. Last week we did do a mock patient day, so we as instructors acted as patients in the lab, so I thought that was pretty cool. We got to basically go around to the different groups and act as patients and give them like a mock practical, but much longer time frame, and we got to pause and give feedback and discuss things. So I thought that was really good. I think all programs do some aspect of that. Of course, most programs this year can't really bring anybody in because of the virus, which sucks, but is what it is. Got to keep rolling with it. So that's pretty much it. Nothing too exciting last week. Just getting anxious and getting prepared for this next week. So thanks for watching this reflection, and be on the lookout for some more videos.